This isn't the weed that they were smoking in the 70s. Marijuana does have physiological withdrawals. 3 things that you may not know are connected to anxiety. First thing we have, caffeine. Caffeine is strongly linked to anxiety. Caffeine is a stimulant, which means that it increases your heart rate and blood pressure. It triggers the release of different stress hormones like cortisol and adrenaline, and it creates the physical sensations that also can mimic anxiety. So if you're a caffeine drinker, if you've noticed that you've been having some racing thoughts or can't really, ease your mind, there is a link between caffeine and anxiety. So what can you do to help if you are a coffee drinker? So first, you want to reduce your intake gradually. You don't want to go cold turkey, quote unquote, because that could cause headaches because they may be used to the caffeine. Another recommendation is maybe switch to green teas or herbal teas. Sometimes that natural caffeine may be a little bit more tolerable than, let's just say, a coffee or a Red Bull or different things like that. And then also you want to track your intake and how your body is responding, right? So if you're someone who's going from 5 cups of coffee a day, maybe try to bring it down to 2 and then track how is your body responding to that. Are you noticing that you are more anxious? Are you noticing that you're a little more level-headed and different things like that? But number 1, caffeine is linked to anxiety. Number 2, this is going to be controversial, but we're here. Marijuana. So research has had different results when it comes to, marijuana and anxiety. It's been documented for the use of alleviating anxiety through CBDs and different things like that. However, research has also shown that there's a strong correlation with anxiety, panic, paranoia, and psychosis when it comes to marijuana. So even when it initially does help reduce feelings of anxiety, it's what we call the marijuana cycle, because what it's going to lead to is increased baseline anxiety over time, dependence on cannabis or marijuana to cope when you are stressed, anxiety during periods where you're not using and or withdrawals, reduced tolerance to stress without substances, feeling on edge when you're not using it, and using marijuana to mask your emotions as opposed to really dealing with them. So marijuana linked to anxiety as well. What could you do to help you? So 1, you want to be clear on why it is that you want to stop. Is this hurting you or is this helping you? Expect short-term withdrawals if you do stop. Nowadays, this isn't the